An aspirin a day could keep a second heart attack or stroke away. That's what a study by Washington University School of Medicine and University of Michigan confirms.
We believe for those who've already had a heart attack or an ischemic stroke, are already at a greater risk for having a recurrent vascular event.
The study's first author, Dr. Kyle Yu, says aspirin thins blood to prevent it from clotting.
Despite the risk of bleeding that we always worry about aspirin, for many people, aspirin may provide greater benefits.
Researchers analyzed data from nationally represented health surveys among 51 low, middle, and high-income countries. They found despite aspirin's benefits and low cost, only 16.6% of people who've experienced a first heart attack or stroke in low-income countries subsequently use the medication for prevention. In lower middle-income countries, that figure sits at 24.5%. In upper middle-income countries, it's 51.1%. And in high-income countries like the U.S., it's 65%.
We know that cardiovascular disease burden has devastating outcomes on not only at the healthcare systems level, but also at the economies of these nations.
But even in North America, where buying aspirin is as easy as walking into your local pharmacy, Dr. Mohammed Kadra says patients don't know of the benefits.
Us as physicians, we're failing our patients in properly educating them about that benefits of aspirin. So I do spend a huge chunk of my time on counseling my patients.
Of the cost barrier, he says nearly a year's supply of aspirin costs the equivalent to a pack or a pack and a half of cigarettes. Even though the relationship with heart health and aspirin has been studied as far back as the 1970s, this study points to gaps in awareness.
Our study suggests that we have a lot of reflection to do and a lot of room to improve from prior studies.
While aspirin has proven benefits, researchers note it's important to talk to your healthcare provider before starting any course of medication. Alexia, Kapralos, Global News.